Thanks, Rob. And I don't know if we need to actually introduce everyone. We have our first speaker who started us off strongly with her personal experience and her journey with her new degree and her new academic role. So Susan, thanks for joining us again. And we also have Dr. Leroux joining us as well. She gave us 2 strong presentations, interesting dialogue in the chat, great questions. And Janice, thank you so much for joining us too. Persons need to express themselves well, and being able to hear about CBT and all the other resources are very important. Elizabeth, do you want to join for the afternoon speakers that joined us?
Absolutely. So just to cap it off, I think it's really important because we started today talking about biopsychosocial approach, and there is nothing prettier than looking at this gallery of people and seeing all of them available for people to ask questions. And we have everything from dietitian, Laura, welcome back, Shannon with movement, Werner and Dr. Nash focusing on neurology, and lastly, bringing us all together to join forces and advocate is Wendy. So if everybody can turn their cameras on, we are going to open this up to a Q&A moderated by the Presidente himself, Robert.
Thank you very much. So we have a good group of questions here, and I'll kind of pick on a few of you as we go through it. The first question is, what is recommended for helping partners, families, and loved ones in understanding migraine? Are there specific types of counseling recommended? How can a team help with this? And I'm going to pass this over to Janice.
Hi, thanks. That is a very good question. And I often do meet with partners, with the client or patient there, because migraine does have a huge impact on the whole family. And so in terms of, some partners do choose to get their own counselor for support to work through. Sometimes there's grief about what they anticipated in terms of what they might do with their partner or what might get in the way of their family life. It might be that the burden of responsibility in terms of childcare and other things has fallen on the partner more when the individual with migraine is really struggling. So often there is irritability and anger, which often relates to a sense of powerlessness in terms of being able to help and so on. So no one answer to that question, but certainly inviting partner into the process and encouraging them to have a space that they can talk about the impact on them can really help, because often what people describe is, whenever I say a migraine's coming, my partner gets irritable, so on. And so it just kind of opens up that conversation. They can talk about, there's the 2 of us, and then there's this migraine in the middle, and it's like a third body in our relationship, and let's talk about it so that we get it out of the way. So long-winded answer. I don't know if that answers the question.
Well, I think it's great. And I think it does talk about the need to have families involved in the whole process. And obviously, we know that how devastating migraine can be to people, but also kind of understanding some of the treatments. I'm curious, knowing that there's a lot of novel treatments, a lot of emergent treatments, a lot of new treatments coming up. Dr. Nash, what do you do when you have kind of patients asking about their families and questions? How do you kind of field that and work with the families?
Well, it's been a little bit more difficult with COVID. We've actually been really restricted with how much interactions we can have with patients, families, and loved ones and partners, just because we're kind of restricted to how many people we can see at one time. Before COVID, obviously people were certainly encouraged to come into appointments. 2 heads are always better than one, and certainly family members have medical questions, and a lot of time patients and family members have done their own research, and it's good to have a dialogue with everybody who's involved.
Awesome. And Susan, you've been in the position. I'm curious how the response has been for you and how you kind of bring the family and loved ones and other supports into it.
I think learning how to communicate really well. I had just gotten married after my migraine started, and started very chronically. We were 2 weeks into a marriage and we were young. And so I think learning to practice those connecting communication strategies and to recognize when we are disconnecting was really, really important. And to also have really strong boundaries with each other, and to be able to communicate those boundaries effectively and work together as a team.
Awesome. Well, thank you, Susan. And I guess, there's always going to be a lot of answers for this. Anybody else have any other thoughts on that question?
Yeah, if I can chime in, I would say I often encourage family members and support people to attend nutrition appointments with patients as well, given that, meal prep is a big piece of this, and having family support around that's important. I think also recognizing that spouses aren't always in perfect health themselves. Oftentimes we see, multiple chronic conditions within the same family. So really working together to distribute the responsibilities and figure out the best way to support each other is definitely key.
I find that often, of course, getting the partner or the family in the office, but it all starts with validation of the diagnosis and telling the partner that, yes, these symptoms exist. And yes, it's normal to be struggling. And sometimes having a doctor or a healthcare provider saying, yes, this is what migraine is, and it's normal that this is difficult, and putting this powerlessness on the table, opening these difficult zones, can really lead to a more supportive environment. It's something that is very, very important. In a survey done in the US, a lot of people with migraine said that their partners didn't even believe they had migraine to start with. So we really have to start there and then build on it.
Excellent. Thank you, guys. The next question is really interesting because I've heard this as well. Things like acupuncture, massage, even piercings. Any thoughts on kind of the manual and the movement kind of stuff? And maybe I'll open it up to Shannon and see how many of your patients are doing this on top of some of the exercise.
That's a really good question, Robin. In fact, because I work at a physical therapy clinic, a lot of my patients are seeking manual therapy and that sort of intervention, and come in expecting a lot of passive treatments. And so, sometimes this can provide some symptomatic relief. And I think that, as Dr. Nash alluded to, as pain sometimes is starting in the neck, people may not really understand that there is likely another driver. And so my role often in this clinic is to help screen patients for migraine and then send them off, refer them to another physician to get that diagnosis and some treatment on board. I think that there is some limited benefit to it, and I don't want to take away the idea that symptomatic relief has no place. Obviously, whatever people can do to feel better is helpful, but I always try and put that in the context of the importance, and emphasize the importance of getting that migraine diagnosis if I think that's what's behind some of these presentations. And then, of course, I always get in my 2 cents about appropriate movement and integrating that as a strategy for self-management as well.
Excellent. And, I guess that would shift over, what does the evidence have to say about things like acupuncture and massage? And maybe Dr. Becker, you can talk a bit about that as somebody who's not only started interdisciplinary, but, one of the founders of such.
Well, first of all, I wouldn't recommend the piercing part. As for acupuncture, a fair bit of research on that. And it's been a bit controversial in general, and the research up to quite recently, when you did real acupuncture and had a group that had so-called sham acupuncture, and then you had a third group that were called sort of waitlist controls that had no treatment. The two acupuncture groups did better than the waitlist controls, but the sham acupuncture and the real acupuncture were pretty similar. So what can you do with that? Now, more recently, there's been a little evidence that acupuncture, in fact, is a little better than sham acupuncture, but there was a recent editorial, well, not recent now, it's been a year or two, that acupuncture was in fact just a big placebo. And of course, the more aggressive your intervention is, the bigger the placebo effect. And so that's why acupuncture works. It's a big placebo. Doesn't really matter if it's done according to Chinese traditional medicine principles. It's the actual hands on the patient with putting needles in. But I'd welcome Elizabeth's comments on that because she may have seen something more recently that I haven't seen.
Thanks, Dr. Becker. No, you're right on. I think we underestimate the power of the placebo response in pain medicine. So the dive piercing, which some of you might have heard about, which is putting a little piercing in the crunch of the tragus, we call it, in the ear, has gained a lot of visibility on social media. And from a scientific perspective, most headache experts I know do not believe there is any real effect on the pain system of this piercing. But placebo is powerful. So whatever you do, and if there's a needle involved, and also a strong belief from the person receiving it, and a strong belief from the person selling it to you, or promoting it to you, or just encouraging you, the response can be good. And the other thing you have to know when you hear about success and miracle stories about these approaches, which may sound miracly, well, just remember that it's very rare people come back to Facebook to say, oh, I thought my piercing was working, but 3 months later it didn't. So science tells us that, sticking needles can decrease pain. My only concern is, of course, financial abuse when there is like a lot of cost associated with procedures. And this is true for the so-called migraine surgeries we see in the US, and they are heavily promoted with no scientific basis so far. And then there's some risks as well. The dive piercing can get infected and it can be painful. So there's also some medical risk. So placebo can be good, but it can be costly and it can be in certain circumstances dangerous. So you make your decisions, but acupuncture, I recommend it heavily if someone wants to try it during pregnancy. It's safe. It's a fantastic thing, but after a few weeks and months of paying for acupuncture sessions, patients usually tire of it.
Thank you so much. And, I'm going to pass it over to the real expert here and see what Susan has to say. And have you done some acupuncture, massage, other types of treatments?
Yeah, so I kind of disagree that it's placebo. And again, I haven't done a lot of reading on the actual science, but just from my own experience, I am very skeptical of many different things. And my physician actually practices acupuncture. And I went into his office one day. I had an intractable migraine. It lasted for days. I said, I can't get rid of this with medication. And he said, okay, I'm going to do some acupuncture. And he didn't do the traditional acupuncture. He just took a needle and he stuck it in my neck and he wiggled it around and it hurt and it was terrible and I hated it. And when he was done, the migraine was gone. I didn't believe that it was going to take the migraine away. I thought it was stupid. I was very against the entire procedure, but it did work. And so I've tried acupuncture with mixed results. If I'm having a really, really bad migraine, I've gone to the physician office and he's done that and it's worked. I've done acupuncture where they put like the seeds on your ear for anxiety. I don't think that was very effective for me. And I've had acupuncture that's more traditional for migraine, where you relax in a room and they do a bunch of different pressure points. But I do think that there is something to it. I don't know if stimulating certain nerves can have, a pain relieving response. But I mean, that was my experience with that.
Thanks.
Thank you, Susan, for mentioning that, for sharing that. I was talking more of acupuncture as a preventive treatment. But, the brain, of course, is wonderful, isn't it? And I'll just share a very brief story about the American Civil War. General Grant had bad migraine, and at the sort of final battle in the war, General Grant had a terrible migraine, and he was busy up all night with his feet in mustard water and stuff, trying to treat his migraine, and it wasn't getting any better. And then suddenly this messenger arrived from the Confederate Army saying that they were willing to surrender. And General Grant writes in his memoirs that at that point, my migraine vanished instantly. So, Yes, the brain can turn off migraine given certain kinds of stimuli and inputs.
Excellent. Yeah, there's also something to be said. There's a lot of data on touch, the importance of touch. You also mentioned something else important, Susan, was also the environment. The traditional come in, relax. Often there's a little bit of massage pieces to it, and there is something to be said, especially somebody who feels invalidated, hasn't been listened to, hasn't been connecting with any of their providers. And then they meet someone who's validating, connecting, and creating that personal touch, which COVID, I mean, we can't even go into some of the
Rabba, I have to share another war story then.
Yeah. Oh,
so, this was from a conference, and it was a striking story about, I'm not sure which campaign, but imagine like a dying soldier, all crushed by some terrible injury, screaming in pain, screaming and screaming and screaming, terrible. And the story is that a fellow soldier came and because everybody was afraid by how terrible he looked and didn't want to touch him. And then a fellow soldier came and held him in his arms, and instantly the soldier felt better and stopped screaming and was relieved. So how true is this story? I don't know. I wasn't there, but it just speaks to the strength and the power of support and empathy and rituals and beliefs. And about for Susan, if you stick a needle in the neck somewhere and you have a migraine, for sure it can have some biological effect. Acupuncture may be different. So we do it all the time. I take patients in to do nerve blocks, occipital nerve blocks or face blocks when they have a migraine attack. And this is something that absolutely can have a biological effect.
And can I add to that as well, Susan? I think what you might be referring to with the needle and poking it into the muscles in the neck sounds like an IMS type of technique, which is that dry needling technique. And I think some of the pain that migraine patients talk about is this trigger point referral. And it sounds like that was possibly what was helpful for you in that situation too. And of course, as you say, Liz and Dr. Becker, these principles of relaxation certainly are being capitalized on with that kind of therapy as well. So I can see why that was helpful for you.
Mm-hmm. Yeah, really good call on that. And I was actually thinking the same thing. It sounded more like IMS, especially when you said it hurt terrible. It's like, well, that's IMS. But I think it also talks again, touch and not really knowing everything that we think we know. In fact, I think there's more that we don't know than there is that we know. And that's a part of the process that we get through. Okay, moving on. We've talked a bit about hormones. What are the role of hormones in migraine? If migraines settle during pregnancy, do they return postpartum? Talking about pregnancy or menopause as well. And are there different medications for these circumstances? So I'll pass that over to Dr. Nash.
So absolutely, hormones are a major player in migraine. So you can look at rates of migraine in different populations, different age groups. And before puberty, boys and girls actually have equal rates of migraine. So the pediatric population, there's really no distinction. And then after puberty, women then double men, and the rates of migraine remain double for women throughout the rest of adult life. There's been lots of attempts to manipulate hormones over the years, whether it's using estrogen supplementation, being on cyclical birth control, non-cyclical birth control. At times, people have even been referred for hysterectomies and having their ovaries taken out as well to induce menopause. And hormonal manipulation hasn't been robustly or reliably effective as a cornerstone to migraine therapy. In regards to pregnancy, certainly we do see
available in a melt form.
Oh,
I don't know. Keep going.
During pregnancy, certainly we do see migraines dramatically improve for a lot of women, particularly after the first trimester, when estrogen and progesterone levels have really peaked. And yes, certainly migraines can come back with a vengeance after delivery and after breastfeeding. menopause is a bit of an unpredictable time. It's a little bit like spinning a roulette wheel. There certainly are women who will have their migraines dramatically improve and in fact go away. But unfortunately, some women don't have any improvement. And for some women, their migraines completely change. They may start getting auras, which again were those flashing lights or holes in the vision, with their migraines, without their migraines. And unfortunately, some women will even have their migraines worsen after menopause. And we haven't learned how to predict who's going to be who at that time.
Now we know that puberty and menopause also come with a lot of other changes, not just affecting our migraine, but affecting our emotions and our mood. Janice, do you also see some differences during these periods?
Not specifically. I do tend to see more clients who are getting close to or at kind of perimenopausal age. And I don't really know what the hormonal contribution is to that. Sometimes it's more that they have been living with this for a long time and they're fed up and they're worn out and they have multiple stressors and so on. It's hard to know what's what. And that's interesting. I haven't specifically, a lot of people will say I'm affected by hormones, but I don't really know. Okay,
thanks. I've heard that there's some YouTube stuff, Wendy, on the Migraine Canada website, and that there might be something about hormones that people could look at. Oh, you're on mute.
There we go. Yeah, we have a lot of information on our YouTube channel about a number of different topics, including, all of the webinars that we've recently had, and we'll continue to keep building the library as we deliver programs and that kind of thing. I don't know specifically what is there.
Wendy, we had a webinar with Dr. 𝐒𝐿𝐿 on hormones and female cycle. Dr. 𝐒𝐿𝐿 is a great expert, and you just have to go on YouTube. We can share the link maybe and go on our YouTube channel for a full. And actually, there's also webinars. I give webinars on CGRP antibodies, the science of migraine. Dr. Kingston talks about cluster headaches. So I encourage you to go on our YouTube and look around.
Perfect. So moving over to the B vitamins, there was mention about maybe some of the B vitamins not being safe in pregnancy, and if there was any evidence actually in B12 and preventative, and I'll hand that over to Laura.
Yeah, good question. So when I was looking through the literature, I didn't come across much there, but maybe Dr. Becker would be better able to comment on this one.
As far as I know, the only vitamin that's helpful is B2. Vitamin D, maybe, but vitamin B2 riboflavin, has randomized controlled trials that show benefit. Now, it's not a huge benefit, I have to say, and the trials were done in Belgium. So I once asked a headache expert a few years ago, does vitamin B2 really work in migraine prevention? And the person said to me, only in Belgium.
We see this often in studies crossing from Europe and North America. Okay, moving over, the role of triggering migraine with exercise. There was mention of nitrous oxide increasing with exercise. Could this have a role in the migraine process? Shannon.
Thanks, Rob. Yeah, the literature does seem to demonstrate that this increase in nitric oxide is related to a pain decrease, specifically for migraine patients. Now, the study I'm referring to is a Turkish study. I'd have to double check and see if this was found to be a clinically significant difference. But this is what the authors sort of postulate, that they believe that it's possible that this nitric oxide change could be part of why exercise is helpful. NO is obviously, I stated, a vasodilator, and so we can understand this would influence migraineurs quite specifically. Oh, I can't hear you, Rob.
I'm on mute. So maybe we'll, that's the saying of 2020, but it seems to be floating into 2021. I'd like to pass it over to Susan, and just curious, and I know this is an N of one and you know, when we look at data, but what have you noticed with exercise and some of the lifestyle management skills with regards to migraine and your health?
Yeah, so exercise has been a really great preventative for me. I do a combination of yoga and cardio and weights. And I do find when I started to get into more exercise, certain exercises did trigger my migraines. And I kind of had to get over a hump. And then I found that the preventative benefit was really, really good. So that's what I found with exercise and diet and stress reduction, and just all of those lifestyle pieces are so, so important. And it's so individual. So finding a plan that works for you, I think, is really important. And that means a lot of trial and error, keeping a journal, writing things down, you know, evaluating the effectiveness of things and sticking with them for a period of time so you can really see if they're working or not.
I really love what you said there, Susan. I particularly appreciate your advice to stay with it. And I think this is something that is very difficult to do when, you know, you're confronted with pain all the time. We just want something that's going to work quickly. And unfortunately, like, you know, some of the medications you spoke of, Dr. Becker, you know, exercise, the effects of exercise aren't necessarily going to happen overnight. I think the key thing is to be consistent over time, which doesn't mean to persist if your migraine is extraordinarily painful. That's not it. You know, to develop some flexibility, but consistency over time will get you the best results. And as much as people really don't love to keep track of things like exercise and pain, it's so helpful when patients bring to me a diary which articulates what they've been doing and the pain associated with that. And then we can look at trends, and then it's fun. Then we can really make some good change.
And I think also, just if you are in that process where you're trying out different exercises and you're having attacks, in my case, it was more vertigo and visual issues. And I found that having a safe person around when I was hopping on the elliptical or doing yoga was actually really important for me, so that I felt a bit calmer to kind of push through those moments. So that could be a strategy that they use as well.
Excellent. You know, I'm gonna open one last question before we go, and I know we're just right on the edge, but I think it's an important question. And one of those is pregnancy, and we know that migraine can sometimes dissipate in pregnancy, but sometimes it can do the opposite. Are there any recommendations? We often hear don't take meds during pregnancy. Are there any recommendations that anybody would make for treatments during this time outside of some of the exercise, mindfulness and psychological treatments? Are there any medications that are often your go-to during this period? And maybe I'll pass it to Dr. Nash, and then we'll bring it up to Dr. Leroux.
So certainly our options are going to be a lot more limited on the medication side. We're sometimes forced to use medications that aren't particularly effective, like Tylenol. And for people who saw my talk earlier, against what I had said previously, sometimes Tylenol 3. I think pregnancy is the one time that we'll use a mixed analgesic that has an opioid in it. Those triptan medications, if you look at the labels, you really aren't supposed to use them in pregnancy. But there's very long registries, which means they track everybody who's been accidentally exposed to a triptan in pregnancy. So there's one that's over 20 years long now of all the accidental pregnancy exposures to sumatriptan, that's Imitrex, and naratriptan. I actually didn't see any loss of pregnancies, fetal malformations, no complications of pregnancy at all, pregnancy complications otherwise. And a lot of the restrictions that were advised previously, there probably wasn't a complete understanding on how the medications were working. So the thought was perhaps that these triptans work by causing constriction of the blood vessels in the brain, and that's really not how they work. They actually work on the nerves. So the concern was that there might be severe constriction of placental blood vessels, for example, and that really hasn't played out in observations. On the flip side, if somebody's having a lot of headaches, Dr. Becker had spoken earlier about preventative medications. We have a couple that are safe in pregnancy, an old antidepressant family called the tricyclics, and some old blood pressure medications called beta blockers. The problem with those is that all of our preventive medications usually take about 2 to 3 months to really kick in and become effective. So for a lot of women, by the time we start doing a preventative in pregnancy, perhaps things have already moved in the right direction anyway. It's too late to have started those.
Excellent. And anything to add to that, Dr. Leroux, Dr. Becker?
No, it's pretty, that's exactly it. I will add the acupuncture piece. I mean, why not? It is safe during pregnancy. There's actually a study showing that if you learn to use biofeedback, but I will assume it applies to other techniques before pregnancy, then you can actually master your migraines better. For those who are on Botox, this is maybe a bit sensitive because Botox is officially contraindicated during pregnancy, but we have now accumulating data that is reassuring. So I've had patients who were doing terribly before Botox, then they improved. And so they said, yay, now I can have a baby. And then they said, well, yes, but if I fall pregnant, what's going to happen? If I stop the Botox, I'm going to go back to throwing up and going to de-emerge and having to take tons of triptans. I cannot do this. So I encourage you out there to have your discussion with your healthcare providers about this. CGRP antibodies for now, a big no with pregnancy, up to 4 or 5 months prior, because the CGRP plays a role in the placenta formation. So better stay away from this, and fully agree with Dr. Nash. It's better wait and do other techniques than taking drugs. But we have a few options, and nerve blocks. A lot of my colleagues are doing nerve blocks as well for kind of big, bad attacks that won't break. That can be helpful.
Can I just add to that? Like you mentioned, biofeedback, and certainly I get referrals for people who are pregnant and not able to take the medications, and certainly finding ways to address other potential effects, triggers, and so on can be hugely helpful when they don't have access to the usual medication. So that's when people often will choose cognitive behavioral strategies, is when they simply can't take the medicines, and that will often help them turn a corner even afterwards when they can take the medications again. Then they'll just continue with those strategies as well.
And they deal with the young baby.
Which is pretty stressful, which we know stress and headache don't go well together. Look, a big thank you to Dr. Becker, Dr. Leroux, Dr. Nash, to Wendy, Janice, Shannon, Laura, Susan. You guys have been amazing. And please welcome me in thanking all of you for all of your work and everything that you've done to make this event happen, and for volunteering your time to be here. Nobody's being paid. We're all doing this because we want to be here and we want to do this. And that's what's most important. So again, a big thank you to all of you, and thank you for making this event so incredible. Thank you to Elizabeth and Christelle, our incredible co-chairs for this. You guys have been amazing in presenting, and thank you for being here and being with us. A big thank you to Migraine Canada, our partner, and really looking forward to continuing to work with you now and into the future. And hopefully we can do this more often. And please check out their website, incredible resources. You don't want to miss that. So go on to Migraine Canada and please check that out. Thank you to each of our not-for-profits who have been involved: Help Alberta's Pain, Alberta Talks Pain, and the Alberta College of Family Physicians Collaborative Mentorship Network. Really incredible groups that are here to advocate for you. And that is what's most important. And most importantly, thank you for being here, because it's really about you coming and learning about what you can advocate for. And sometimes in a difficult system, this is how we have to do things. You need to know what options are available. You need to know what is best for you moving forward and how you have options that you can advocate for. Thank you to Teva, sorry, I've been told, our platinum sponsor. And finally, if you really did enjoy it, please feel free to jump on and jump onto tickets. Thank you for everybody who has donated by purchasing a ticket, and you're able to do so again by repurchasing, so that again, we can continue to provide these events for as many people as possible. And don't forget, there are evaluations. Please do your evaluations and let us know how well we did. And more so, what can we do to improve, and what things would you look forward to if we were to do this again? So, we're signing off a few minutes early, and I'll hand it over to Christelle and Elizabeth. If there's anything more to add, please add at this time.
Thanks, Rob. I'll quickly just say thank you to you. Your passion, your expertise, your enthusiasm, and all the ways in which you lead us and encourage us as a team to move forward to support folks living with pain, especially with migraine and headache. We really do appreciate that. And it truly does take a team to make the dream work. So we're thankful for all attendees. We look forward to seeing you in the fall for other events to come on the Pain Society of Alberta. And we hope that you gleaned some nuggets, again, practical pearls that you can do to increase your toolbox. So thank you so much. I'm going to pass it on to Liz and just keep it brief. We want to give you back your Friday, few extra minutes on your Friday.
And the only thing I'm going to say is this is everything about this was meant to be so that we can be accessible and you can go out and change something tomorrow or on Monday after the weekend to change how you experience and live with pain or how you treat it. Thank you so much, everyone. Have a good Friday.
Awesome. Thank you, Liz and Christelle. Thank you to all our presenters. Thank you to everyone who signed in today, who gave up their Friday to be here with us. It means everything to us, and I hope everything we've done means something to you. And I hate asking for money, but I'm going to say it again. Feel free to re-register and to donate. We want to do this. We want to keep doing this, and sustainability is so important. Make sure you go onto Migraine Canada's website, check out their incredible resources, sign up and register to be a part of and follow with them. Again, we advocate stronger when we do it together, because together we can change everything. Again, thank you all and have a wonderful weekend. And until next time, goodbye.